What if the real reason you're struggling with diabetes isn't just sugar or medication, but something even more overlooked? Most doctors will tell you to cut carbs or take your meds on time, but rarely do they explain how critical nutrients are to managing diabetes. Here's the surprising truth. Without the right vitamins and minerals, insulin doesn't work properly, nerves weaken, and complications set in faster. Even crazier, most diabetics are deficient in these essential nutrients and don't even know it. If you feel constantly tired, deal with random aches, or can't seem to get your blood sugar under control despite your best efforts, your body might be missing something vital. Fixing that gap could change everything: how you feel, how you heal, and how you live with diabetes. In this video, we'll break down the most important nutrients for diabetics and exactly how to make sure you're getting enough every single day. If this helps, please consider subscribing to support our work. Let's start with something most people overlook: vitamin B6. It may not be the first thing that comes to mind when managing diabetes, but for those living with high blood sugar, it could be a hidden game changer. If you're diabetic, your body flushes out B6 faster than normal, especially when your blood sugar is elevated. Why? Because your kidneys work overtime to eliminate excess glucose. And in the process, this critical vitamin is lost too. Add to that the relentless inflammation and oxidative stress caused by diabetes, and your body starts burning through B6 just to stay afloat. Even high insulin levels can interfere with B6 metabolism, reducing its effectiveness where it's needed most: your cells. The situation gets worse when you consider how many common medications, like metformin or blood pressure drugs, drain B6 even further. It's no wonder many diabetics are unknowingly deficient. What makes this tricky is that B6 deficiency often hides in plain sight. You might not get obvious symptoms at first, but if you're feeling constantly tired, battling brain fog, or struggling with mood swings, low B6 could be playing a role. One of the biggest red flags: nerve problems, such as tingling, burning sensations, or numbness in your hands and feet. Muscle weakness, poor coordination, or even dry, irritated skin and frequent mouth sores might also creep in without clear explanation. A weakened immune system is another subtle warning sign. In more severe cases, B6 deficiency can lead to anemia, causing dizziness, pale skin, and shortness of breath. But the impact goes far beyond just a few nagging symptoms. Low B6 can disrupt fertility in both men and women. For men, it may mean reduced testosterone and sperm quality. For women, it can lead to irregular menstrual cycles and more intense PMS symptoms. It also plays a role in libido, thanks to its influence on neurotransmitters like dopamine and serotonin, which regulate both mood and energy. The nervous system especially relies on B6 for healing and protection. Without it, nerve damage progresses faster and recovery slows to a crawl. Your kidneys suffer too. B6 is needed to fight off inflammation, and without it, your risk of kidney complications jumps. Your eyes are at risk as well, since B6 protects the delicate blood vessels in the retina. Without enough of it, diabetic retinopathy can speed up, leading to blurred vision or even blindness. Your heart and blood vessels also depend on this often ignored vitamin. B6 helps lower homocysteine, an amino acid that can damage arterial walls and raise your risk of high blood pressure, heart attacks, and strokes. When B6 is low, blood vessels stiffen and circulation problems worsen. On a cellular level, it's essential for glucose metabolism. It helps break down glycogen, your body's stored form of glucose, ensuring that energy is released gradually rather than in erratic sugar spikes and crashes. Without B6, blood sugar control becomes tougher and insulin resistance can deepen. It's also vital for the production of neurotransmitters, which helps explain why deficiency often shows up as anxiety, depression, or low mood. On top of all that, B6 is required for hemoglobin production, the protein that carries oxygen in your blood. Without enough, your cells become starved of oxygen, leading to fatigue, slower healing, and overall poor energy levels. The best part? Boosting your B6 levels can be simple and delicious. Chickpeas are one of the best sources. Just 1 cup cooked provides about 55% of your daily needs. Beef liver is another powerhouse, offering around 50% per 100 grams. Wild-caught salmon supplies roughly 40%, as does turkey. And if you're a fan of healthy snacking, sunflower seeds provide about 30% per ounce. These foods not only support your B6 levels, but also promote better nerve function, a stronger immune system, and improved metabolism, critical for anyone managing diabetes. If you enjoy gourmet meals, there are luxurious yet health-boosting options. A Japanese-style miso-glazed salmon paired with half a cup of chickpeas, about 180 grams of salmon, delivers over 90% of your daily B6 needs and packs heart-protective omega-3s to boot. Try a French-style beef liver pâté with roasted garlic potatoes. 100 grams of liver and a single medium potato give you around 85% of your B6 needs, along with iron and B12 for energy and blood health. Or savour a Mediterranean chickpea and grilled lamb stew with saffron. 200 grams of lamb with 1 cup of chickpeas delivers roughly 80% of your daily B6 and provides essential amino acids that support immune strength and muscle repair. And if food isn't enough, supplements can help. The most effective form is P5P, pyridoxal 5-phosphate, a bioactive version your body can use immediately. Look for high-quality options like Thorne Research P5P, 33 milligrams per capsule, or Pure Encapsulations, vitamin B6, 50 milligrams per capsule. Most diabetics do well with 25 to 50 milligrams daily, but it's always smart to check with your doctor before taking higher doses. However, even if you're eating well, certain foods and habits can worsen a deficiency. Refined grains like white bread and pasta lose most of their B6 during processing, better to avoid them. Diets high in sugar increase insulin spikes, which burn through your B6 stores even faster. Alcohol interferes with B6 absorption and breaks it down more quickly in your liver. And remember, common medications like birth control pills, metformin, and antihypertensives can deplete B6 over time, making it essential to replenish through food or supplements. Vitamin B6 might not get the spotlight like other nutrients, but make no mistake, it's a powerhouse for diabetics. It helps insulin function more effectively, protects your nerves from damage, supports your heart, keeps your energy steady, and improves blood sugar control. If you've been struggling with fatigue, mood swings, nerve pain, or just can't seem to stabilize your glucose levels, it may be time to check your B6 intake. Don't underestimate this quiet nutrient. It could be the missing link in your diabetes management strategy. Number 2, vitamin E. Imagine a shield inside your body, one that protects your nerves, blood vessels, and cells from daily damage. That's exactly what vitamin E does. But here's the catch. If you have diabetes, that shield wears down much faster than normal. Elevated blood sugar levels create a storm of oxidative stress, forcing your body to use up more vitamin E to fight off cellular damage. The problem doesn't stop there. Vitamin E is a fat-soluble vitamin, meaning your body needs healthy fats to absorb it properly. But for diabetics, fat metabolism is often compromised, making it even harder to maintain adequate vitamin E levels. Even worse, a vitamin E deficiency often flies under the radar. You may not notice it right away, but the first clues could be muscle weakness or trouble with coordination. That's because vitamin E is crucial for proper nerve function. When levels drop, communication between your nerves and muscles begins to break down. You may start feeling numbness, tingling, or burning sensations in your hands and feet, symptoms that are often brushed off until diabetic neuropathy sets in hard. And if your skin seems drier than usual, irritated, or slow to heal, vitamin E could be the missing link. But that's not all. Vision problems like difficulty seeing at night or increased eye strain may also be signs. That's because vitamin E helps protect the tiny blood vessels in your retina. And if you're catching colds more often, your immune system might be calling for backup. Vitamin E plays a key role in supporting immune function. A lack of vitamin E doesn't just affect how you feel, it impacts nearly every system in your body. It affects fertility, as it's essential for healthy sperm and egg development. In men, low levels may reduce sperm count and quality, making conception harder. In women, it can disrupt hormonal balance, leading to irregular cycles or complications during pregnancy. Libido can also decline, as vitamin E improves blood flow, vital for sexual function in both genders. The nervous system suffers greatly from low vitamin E. Without it, nerve cells become more vulnerable to damage, worsening neuropathy and slowing down recovery. Kidneys are also at risk. Since oxidative stress is a leading cause of diabetic kidney disease, a deficiency makes it harder for the kidneys to protect themselves. Eye health continues to deteriorate too. Without vitamin E, damage to the retinal blood vessels progresses rapidly, making vision loss a real threat. Then there's your heart. Vitamin E keeps arteries flexible, reduces inflammation, and prevents cholesterol from oxidizing, a process that increases the risk of heart attacks, high blood pressure, and stroke. At the cellular level, it acts like armor, shielding your cells from damage, stabilizing membranes, and preserving essential fats in your tissues. It also enhances insulin sensitivity, which means better glucose uptake and fewer sugar spikes. Plus, vitamin E helps regenerate other antioxidants, especially vitamin C, giving your body a stronger defense system against diabetes-related complications. So, how do you get more of this powerful nutrient? Start with food. Sunflower seeds are one of the richest natural sources. Just 1 ounce, 28 grams, gives you around 66% of your daily needs. Almonds come close, offering about 48% per ounce. Hazelnuts provide about 28%, making them a great snack. For those who prefer vegetables, cooked spinach gives about 20% per cup, while avocados supply roughly 15% per medium fruit, plus the healthy fats needed to absorb vitamin E efficiently. If you're into gourmet eating, there are delicious high-end dishes that deliver a vitamin E punch. A Mediterranean-style grilled sea bass with an almond herb crust, 180 grams of fish with a quarter cup of almonds, can give you over 70% of your daily intake, along with heart-protective omega-3s. Try a Japanese roasted duck breast glazed with hazelnut miso. 200 grams duck with a quarter cup hazelnut offers about 65%, pairing rich flavor with powerful antioxidants. For something truly indulgent, a French avocado and sunflower seed tartare drizzled with truffle oil. 150 grams avocado and 2 tablespoons sunflower seeds. Packs in around 60% of your daily vitamin E in a nutrient-dense bite. Still, if your diet alone isn't cutting it, high-quality supplements can help. The best option is natural vitamin E, D-alpha tocopherol, which your body absorbs better than the synthetic form, DL-alpha tocopherol. One top pick is Pure Encapsulations Vitamin E. Each soft gel delivers 400 IU in a bioavailable form. Another great choice is Now Foods Vitamin E 400 IU, which includes a balanced mix of tocopherols for broader antioxidant protection. Most diabetics do well with 200 to 400 IU per day, but be careful. Too much vitamin E can thin your blood, so avoid megadosing without medical guidance. Watch out for things that make a deficiency worse. Processed vegetable oils, like soybean and corn oil, not only lack vitamin E but also increase oxidative stress. Diets high in refined carbs and sugars spike inflammation, which rapidly uses up your antioxidant reserves. Alcohol is another enemy. It damages the liver, reducing your body's ability to store and utilize vitamin E efficiently. Even low-fat diets can backfire. Since vitamin E needs fat to be absorbed, cutting too much fat can unintentionally reduce your intake. Also, how you cook matters. Overcooking vegetables can destroy a lot of their vitamin E content. Lightly steaming or eating them raw is your best bet. Here's the bottom line. Vitamin E is essential for preventing and managing diabetes complications. Yet, most people, especially diabetics, don't realize when they're running low. If you're experiencing nerve pain, worsening blood sugar control, dry skin, or sluggish immunity, there's a good chance your vitamin E levels need attention. Boosting your intake can help insulin work more effectively, protect nerves and eyes, reduce inflammation, and support better circulation, all of which are critical when living with diabetes. So whether you get it from seeds, nuts, veggies, or high-quality supplements, make sure you're giving your body the vitamin E shield it desperately needs. It might be the nutrient you've been missing all along. Number 3, vitamin C. Vitamin C. Most people think about it only when they're getting sick. But for diabetics, this powerful nutrient plays a far bigger role than just boosting immunity. In fact, it's one of the most overlooked tools for managing diabetes and preventing complications. Here's the twist. Diabetics lose vitamin C much faster than others, and they often don't even know it. Why? Because glucose and vitamin C compete to enter your cells. When blood sugar is high, glucose crowds the path, leaving vitamin C stuck outside. That means even if you're getting enough through food, your cells might not absorb it. On top of that, diabetics deal with chronic oxidative stress, a constant internal battle that requires more antioxidants like vitamin C. And since it's a water-soluble vitamin, it gets flushed out easily, especially with frequent urination, something common in people with diabetes. That constant drain can leave you with a deficiency, and the symptoms aren't always obvious at first. You might just feel tired all the time and not know why. That's because vitamin C is essential for cellular energy production. If you notice bruises forming easily, or if cuts and scrapes take forever to heal, it's likely your collagen production has slowed. Collagen being another critical function that depends on vitamin C. Other subtle signs include bleeding gums, dry skin, or catching colds more often than usual, but the effects go deeper. Joint pain, stiffness, and swelling can worsen without enough vitamin C because this vitamin helps protect cartilage from breaking down. In more advanced cases, a deficiency may even lead to iron deficiency anemia, causing dizziness, pale skin, and fatigue. It's not just about feeling off, it's about whole body dysfunction. Vitamin C also plays a key role in reproductive health. In men, it protects sperm from oxidative stress, supports sperm count and motility, and enhances fertility. In women, it helps regulate ovulation and hormonal balance. Low vitamin C can make conception harder and reduce libido due to its effects on blood flow and circulation. When it comes to the nervous system, diabetics already face a higher risk of nerve damage. Without enough vitamin C, those neuropathy symptoms, like burning, tingling, or numbness, can intensify. The kidneys are under attack too. They rely on antioxidants like vitamin C to reduce inflammation and slow damage. Deficiency means a higher chance of developing diabetic kidney disease. Eye health also takes a hit. Vitamin C helps protect the tiny blood vessels in your retina, and low levels can speed up the progression of diabetic retinopathy, putting your vision at serious risk. But perhaps the biggest impact of all is on your heart. Vitamin C helps keep arteries flexible, prevents plaque buildup, and reduces inflammation. Without it, your blood pressure climbs, arteries stiffen, and the risk of heart disease and stroke increases significantly. On a cellular level, vitamin C is one of the strongest antioxidants available. It protects your cells from the damage caused by high blood sugar, lowers inflammation, and supports the production of collagen, which strengthens blood vessels, skin, and tissues. It also gives your immune system a huge boost, helping white blood cells function more effectively. Another benefit, it regenerates other antioxidants, like vitamin E, strengthening your body's entire defense system. Without enough vitamin C, cells age faster, become inflamed, and stop working efficiently. This accelerates every diabetes complication, from blood vessel damage to nerve degeneration. The great news, it's incredibly easy to get enough vitamin C if you know where to look. The Kakadu plum is the king of vitamin C-rich foods. Just 100 grams provides a mind-blowing 3,000% of your daily needs. Right behind it are acerola cherries, which pack over 1,600% per 100 grams. For more everyday options, look to red bell peppers. They offer about 200% per 100-gram serving and are easy to add to meals. Kiwis follow with around 150%, and strawberries round out the list with about 90%. Plus, they offer fibre, which helps control blood sugar spikes. Love gourmet food? You're in luck. Some high-end dishes pack serious vitamin C power. A tropical ceviche made with Kakadu plums, citrus-marinated salmon, and red bell peppers delivers more than 2,000% of your daily value in just 150 grams, while also loading your body with anti-inflammatory omega-3s. A Japanese-style tuna tartar infused with yuzu and topped with kiwi salsa gives you over 1,000% in a refreshing 180-gram serving. For dessert, try a French acerola cherry sorbet with dark chocolate shavings. 120 grams gives you about 800% of your daily needs, satisfying your sweet tooth without spiking your blood sugar. Of course, supplements can help too, especially if you're recovering from illness or dealing with high oxidative stress. Not all vitamin C supplements are created equal, though. Liposomal vitamin C is one of the most effective forms since it bypasses digestion and gets absorbed directly into the bloodstream. Live On Labs liposomal vitamin C with 1,000 milligrams per packet is one of the best options out there. Another reliable choice is Pure Encapsulations ascorbic acid, delivering 1,000 milligrams per capsule in a clean, effective form. Most diabetics do well with 500 to 1,000 milligrams per day, though during times of stress or illness, higher doses may be temporarily helpful. Just be sure to consult a healthcare provider before going overboard. Certain foods and lifestyle habits can worsen vitamin C deficiency. For example, eating too much sugar blocks vitamin C from entering cells. A high-carb diet may mean your body can't use it effectively. Alcohol not only depletes vitamin C, but also increases oxidative stress, doubling the damage. Overcooking vegetables? That destroys much of their vitamin C. You'll get more benefits by steaming or eating them raw. Smoking is another major problem. It destroys vitamin C rapidly, leaving your body defenseless. And diets filled with highly processed foods often lack the fresh fruits and vegetables needed to maintain proper levels. Here's the bottom line. Vitamin C is a powerhouse nutrient for diabetics. It helps insulin function better, supports immune defense, protects your heart, and slows down damage to your nerves, kidneys, and eyes. Whether you get it from nutrient-rich foods or high-quality supplements, keeping your vitamin C levels up is one of the simplest and smartest ways to stay ahead of diabetes complications. So if you've been feeling tired, catching every cold, or struggling with slow healing, low vitamin C might be the missing link. Make it part of your daily routine, and you'll give your body the tools it needs to fight back, recover faster, and thrive with diabetes.